Have you ever wondered about the state of global health and who's responsible for overseeing it? It's a vast, intricate tapestry, a conundrum of ever-evolving challenges and breakthroughs. The importance of global health cannot be overstated, shaping societies, economies, and the very course of human history. To navigate these complexities, there's a need for a vigilant sentinel, a global guardian that monitors, responds, and guides us through the labyrinth of health issues worldwide. Enter the World Health Organization, or WHO, the watchdog of global health. The World Health Organization was established on April 7, 1948, under the aegis of the United Nations. Stepping back in time, we find ourselves in a post-war world grappling with the need for a unified approach to global health concerns. This led to the birth of the WHO, a specialized agency of the United Nations in the heart of Europe, Geneva, Switzerland. An organization born out of necessity, the WHO was designed to shoulder the enormous responsibility of international public health. Its primary mission, quite simple, yet ambitious, it set out to promote health, ensure global safety, and serve those most vulnerable to health disparities. A mission that transcends borders, cultures, and socioeconomic divides. It's a mission that has guided the WHO for well over 7 decades, as it strives to build a healthier and safer world for everyone, everywhere. The WHO's mission is threefold: to promote health, keep the world safe, and serve the vulnerable. So, what exactly does the WHO do? Imagine a doctor who doesn't just care for individuals, but for the entire world, diagnosing, treating, and preventing health issues on a global scale. That's essentially the World Health Organization, a specialized agency of the United Nations that's been safeguarding international public health since the late 40s. One of the WHO's most crucial roles is providing leadership on global health matters. It's like the captain of a ship, steering the world towards better health outcomes. It helps to shape the health research agenda, deciding which health issues need our attention the most. The WHO also sets norms and standards. Think of it as creating a rulebook for global health. These standards help guide countries to ensure their healthcare systems are effective and equitable. And it doesn't just set the rules, it also helps countries play the game. The WHO provides technical assistance to countries, helping them to implement health policies and programs. This is particularly important for low and middle-income countries that may not have the resources or expertise to tackle certain health challenges on their own. In addition, the WHO is like a global health detective, constantly monitoring and assessing health trends. It keeps a close eye on the state of the world's health, identifying potential threats and areas that need improvement. And when a health emergency strikes, the WHO is there on the ground, coordinating the response. It's like the world's emergency medical team, ready to spring into action at a moment's notice, whether it's an outbreak of a deadly disease or a natural disaster. From leadership to emergency response, the WHO's functions are as diverse as they are essential. And through all these functions, the WHO is guided by one overarching mission: to promote health, keep the world safe, and serve the vulnerable. In essence, the WHO is the world's doctor, diagnosing, treating, and preventing health issues on a global scale. The WHO operates on a massive scale, and it needs a significant amount of resources to do so. To fuel its global health initiatives, the World Health Organization relies heavily on financial contributions from its member states. However, it's not just these member states that keep the WHO's operations running. A substantial portion of its funding also comes from private donors and philanthropic organizations, showing that the fight for global health is indeed a collective effort. Now let's talk numbers. The WHO is supported by a workforce of over 7,000 individuals. These are dedicated folks, working in offices spread across the globe, tirelessly working to uphold the WHO's mission: to promote health, keep the world safe, and serve the vulnerable. It's a massive operation, yes, but one that's essential in our fight against global health challenges. The WHO relies on the contributions of its member states, private donors, and philanthropic organizations to fund its operations. It's a testament to our shared commitment to a healthier, safer world. The WHO has been instrumental in some of the most significant public health achievements of the past century. This statement isn't just a decorative phrase. It holds the weight of countless lives saved and improved health conditions globally. Firstly, let's talk about smallpox, a disease that once swept across continents, taking lives indiscriminately. The WHO orchestrated a global smallpox eradication campaign in the late 1960s, resulting in the complete eradication of smallpox by 1980. This victory wasn't just for the WHO, but for the entire human race, as it marked the first time a disease was wiped off the face of the earth through human effort. Next on the victory list is polio, a crippling and potentially deadly infectious disease. Although not completely eradicated yet, the WHO's relentless efforts have brought us to the brink of eradication. From an estimated 350,000 cases in 1988, the number of polio cases has plummeted by over 99.9% to just 33 reported cases in 2018. But the WHO isn't resting on its laurels. The fight against disease continues. The organization is currently battling health challenges such as HIV/AIDS, malaria, and tuberculosis. These diseases, once thought invincible, are now being held at bay, thanks to the tireless efforts of the WHO. The WHO continues to work on a number of other challenges, such as HIV/AIDS, malaria, and tuberculosis. With its commitment to promoting health, keeping the world safe, and serving the vulnerable, the WHO is indeed a beacon of hope in the global health landscape. Scene script. Like any dynamic organization, the WHO evolves its priorities to meet the current health challenges. And today, we're going to delve into some of these key priorities. First on the list is universal health coverage. The WHO is dedicated to ensuring that everyone, regardless of where they are in the world, has access to the healthcare they need without facing financial hardship. This is a monumental task, but it's one the WHO is committed to achieving, believing that health is a right and not a privilege. Next, the WHO is turning its attention to non-communicable diseases. These are diseases that are not passed from person to person, such as heart disease, stroke, cancer, and diabetes. They're a growing burden globally, and the WHO is working tirelessly to address them, seeking ways to prevent these diseases and improve the quality of life for those affected. Health emergencies are another priority for the WHO. Whether it's an outbreak of an infectious disease or a natural disaster, the WHO is there, ready to coordinate responses and provide support. They are constantly preparing for these emergencies, ensuring that when they happen, they can respond quickly and effectively. Climate change and its impact on health is also on the WHO's radar. They're focused on protecting human health from the effects of climate change, recognizing that this global issue has far-reaching implications for public health, from increased heat-related illnesses to the spread of vector-borne diseases. Lastly, but certainly not least, is mental health. The WHO is working to improve mental health services around the world, understanding that mental health is just as important as physical health. They're advocating for better care, greater awareness, and an end to the stigma surrounding mental health. The WHO is committed to its mission of promoting health, keeping the world safe, and serving the vulnerable. And these priorities reflect that commitment.